due to reduction of the volume of red blood cells in circulation, a reduction in the hemoglobin concentration, or both. Diagnostic criteria for anemia, or some of the diagnostic investigations for anemia. The cause of anemia has to be identified first. A complete nursing assessment, including history taking, and a physical examination should be undertaken. Blood samples should be obtained for HB, that is hemoglobin levels, grouping and cross-matching. Full hemogram, that is what will carry out, that will, the full hemogram will encompass the other aspects such as the hemoglobin as well as electrolytes. Stool samples should be taken also to test for occult blood, ova, and cysts. So generally, the general nursing management for a patient with anemia, the patient is confined to bed rest during the initial period of treatment. The food should be rich in protein, rich in vitamins, with plenty of fluids. Every effort must be made to prevent infections and control pain. Vital signs are recorded every hour. Oxygen is administered as the need arises. Blood transfusion should also be given where necessary. That will be guided by the hemoglobin level estimation. So the lower the hemoglobin level, the need for transfusion. Also, the patient and their relatives will require constant reassurance so that it will allay anxiety and make them to understand the regimen. The drug treatment is given where appropriate to replace any deficiencies. This may include folic acid and vitamin B complex. Analgesics and antibiotics may also be prescribed. All drug dosages are determined according to the needs of the individual child, based on age, type, and degree of anemia. So we are going to go through deficiency anemia, that is iron deficiency anemia. Iron deficiency anemia is the most common in infants and children who are fed only on milk after 4 to 5 hours, when all the reserves of iron stored in the liver have been used up. Iron is essential for production of hemoglobin. Its deficiency may lead to 1. Premature or multiple births, maternal anemia before the birth of the child, of the baby, insufficient iron in the diet, failure to absorb iron in the GI tract, that is the gastrointestinal tract, following neonatal surgery, as well as malabsorption syndromes, for example, the colic disease. So we've noted the 5 factors which may contribute to iron deficiency. We've noted a prematurity aspect. We have noted a maternal anemia, which contributes to the baby's anemia. Insufficient iron in diet is also one of the factors. And we have noted a surgery or a GI issue can contribute to anemia. Pathophysiology of iron deficiency anemia. Iron deficiency anemia develops gradually over a period of time. Iron is essential for the production of hemoglobin. A depletion of iron is followed by a reduction in serum transferrin in brackets, serum beta globulin. This results in a decrease in hemoglobin production. As new hemoglobin lessens, new red blood cells, that is RBCs, become smaller in size. That is what we call microcytic, less well filled with hemoglobin, and pale, hypochromic. Iron deficiency, therefore, results in reduced hemoglobin level and reduced oxygen carrying capacity of the blood. The second type of pediatric anemia is what we call hemorrhagic anemia. I know most of you know that. In this condition, blood loss can be acute or chronic depending on the quantity and the speed at which the blood is lost from the body. This causes the type of anemia in children, which this type of anemia in children, which may include epistaxis. Epistaxis is nose bleeding. Excessive nose bleeding can lead to hemorrhagic anemia, or accidents and various injuries. So we've noted that in this condition, it's basically blood loss, excessive, which can occur acutely, that's over a very short period of time, or chronically. And we know we should factor in the quantity and speed into the question. The third type of anemia is aplastic anemia or hypoplastic anemias. Aplastic anemia refers basically to a condition of bone marrow failure in which the formed elements of the blood are simultaneously depressed. So you noted that the elements which are supposed to be part of the blood formation are not enough. They are depressed in the bone marrow. So the bone marrow fails. In aplastic anemia, it is not only the production of red blood cells that is affected, but also white blood cells and platelets. The patient therefore suffers from anemia, infections, and hemorrhage. The causes of aplastic anemia, we have several of them. So first one is suppression of the bone marrow to produce adequate red blood cells. Number two, primary bone marrow failure of unknown root or origin. The third one is toxic preparations, including drugs like chloramphenicol and phenylbutazone. The fourth is metallic substance such as lead and gold also fall under this category. We have chronic or extensive infections such as osteomyelitis, CA bones, that is cancer of the bones, TB, which affects the bones. Overexposure to radiation is another factor. X-rays, that is radioactive substances which include radium and isotopes. So moving on is hemolytic anemia. This is brought about by excessive and rapid destruction of the red blood cells. From the word hemolysis, hemolytic is destruction. The effect of the destruction of red blood cells is physiological. It's a physiological. The effect of this physiological process leads to reduction in the number of red blood cells and the hemoglobin level. The child presents with jaundice because of the hemolytic issue. The causes basically are infections such as septicemia, abnormal red blood cells such as those found in sickle cell disease, toxic or allergic factors which may be due to certain drugs and or chemicals, the presence of red blood cells, antibodies, incompatible blood transfusion, although this is rare, because all blood used for transfusion is always grouped and cross-matched GXM. The next factor is hemolytic diseases of the newborn and rhesus factor incompatibility. That explains why we should always do a rhesus investigation on the ANC profile and also administer vitamin A to prevent hemolytic disease immediately when the baby is born. Diseases such as malaria. Diseases such as malaria, of course, can cause hemolysis of the red blood cells. What are the clinical manifestations of the hemolytic anemia? So basically, the clinical features of hemolytic anemia depend largely on the severity of the hemolysis. The child may present with 1. Yellowish color, that is jaundice, of course, of the mucous membranes, skin, the sclera of the eye, brought about by excess bile pigment rather, what we call bilirubin in the bloodstream. Also, the patient may also complain of skin irritation caused by bile salts, namely sodium glycocholate. In cases of severe jaundice, the pulse rate may be slow. Another type of anemia is the sickle cell anemia. Medical research has shown that the disease tends to occur as a result of disorganization of certain amino acids in the human body. For unknown reasons, the amino acids in the polypeptide chains are not arranged in their usual orders. For more specific amino acid blend for sickle cell anemia are, so the more specific amino acids are listed below, which are blamed for this disorder or this condition. 1. Glutamic acid in hemoglobin A are in the 6th chain of polypeptides. Valine in hemoglobin S. Lysine in hemoglobin C. Sickle cell anemia is a congenital genetic disease which is transferred from parents to their offsprings. The parents do not necessarily have to suffer from this disease, but they may be carriers of the abnormal gene. The sickle cell red blood cells may have very short lifespan of approximately 20 days compared to the 120 normal average life of red blood cells. Pathophysiology. The consequences of sickle cell disease is secondary to the blockage of the small vessels of the sickle red blood cells. This destruction can be repeated from time to time. There is increased destruction of red blood cells because of the abnormal shapes, fragility, and of course the inflexibility. The blood cells which are sickled meaning they have a sickle shape, like the sickle used to cut grass, causing vascular blockage, can be permanently trapped therein, resulting in blood viscosity, circulatory stasis, hypoxia, and further sickling. So When vascular obstruction occurs, some symptoms experienced include death of the tissues, necrosis, severe pain in the joints, headache. So vaso-occlusive sickle cell crisis also can occur when repeated crises can lead to progressive organ failure. Sickle cells are less able to withstand the stresses of circulation and have shorter survival than normal cells, ultimately resulting in hemolytic anemia. So we have a picture there of the normal red blood cell or erythrocyte and a sickled one. So the sickle cell trait. Sickle cell trait refers to the heterogeneous persons who have both normal HbA and abnormal HbS. These are benign existence of the sickle cell, which an individual can live with under normal physiological conditions. However, if the individual develops severe hypoxia from shock, strenuous physical activity, anesthesia, or flying at high altitudes in an unpressured aircraft, or if an older female patient becomes pregnant, occlusion of blood vessels results in sickle cell crisis. Sickle cell trait has a regular incidence in areas where malaria is endemic. When malaria parasites infect red blood cells, they destroy them together with the sickle cells. General, that is the manifestations of the sickle cell. Basically, these are the manifestations of anemia in general, rather. Possible growth retardation, chronic anemia, possible delayed sexual maturation, marked susceptibility to sepsis, vaso-occlusive crisis, pain in areas of involvement. So we have some areas listed where we can have pain. To just simplify them, we have extremities, painful swelling of the hands and feet, painful joints, abdomen, severe pain in the abdomen, resembling an acute surgical condition, the cerebellum, shock, visual disturbances, chest, symptoms resembling pneumonia, episodes of pulmonary disease, in the liver, obstructive jaundice, hepatic coma, kidney, hematuria, genitalia, painful constant erection, which we call priapism. The sequestration crisis, pooling of amounts of blood, hepatomegaly, splenomegaly, circulation collapse, hyperhemolytic crisis, an accelerated rate of red blood cell destruction characterized by anemias, jaundice, and reticulocytosis. Diagnostic evaluation. Because levels of HbS are low at birth, HgB, that is hemoglobin electrophoresis, is done to determine HgB concentrations. If SCA is not diagnosed early, that is the sickle cell anemia, it will manifest later during toddler life or preschool stages. So also we can do SCA, that is sickle cell anemia, is occasionally first diagnosed during a crisis that follows an acute respiratory tract infection or a GI infection. Sickle cell turbidity test, that is sickle DEXA, for screening from finger stick. Also, if the above is positive, hemoglobin electrophoresis is accurate and rapid to differentiate between those with a trait and those with a disease. The main objective of management are to minimize energy expenditure, oxygen consumption, and promote hydration. Replace electrolytes also is another objective, and treat and bladder, that is, and also treat and control pain using the analgesics available and recommended. the medical treatment is not necessarily, except when the infant is so sick or in a crisis. The patient should avoid situations that may lead to infections, stress, anxiety. For example, shock, strenuous physical activity, anesthesia, or flying at high altitude in an unpressurized aircraft, or if an older female patient becomes pregnant. Oxygen should also be given in case of any crisis of attack. Pain should be controlled. Hydration, we've talked about that. So we will maintain a fluid balance chart during the hydration, and also blood should be checked for electrolyte levels and should be replaced. Transfusions may be given depending on the hemoglobin levels. Basically, the person should maintain hygiene to prevent infections. Also, they should go for, as soon as the condition has improved and the pain is gone or abated, gradual physiotherapy must be commenced to facilitate venous return. So we've talked about the hygiene, general hygiene to prevent infections. The diet should also be given high protein and vitamin-rich foods. The complications include infections of the skin, the respiratory tract, and so on, anemia, congestive cardiac failure, ruptured spleen if enlarged resulting in internal hemorrhage, renal and hepatic insufficiency, gallstone formation, and bone changes. So with that, we now know well and all we are good to go in any issue or anything about anemias in pediatrics. Thank you for the contributors. Let's meet in the next video.